We know it's a start of a long weekend, but that only starts at 4 o'clock in various parts of the country. And we know that you people from KwaZulu-Natal are dealing with a number of different issues, and our thoughts and prayers go out to you because it's very, very difficult there. And hopefully we can get back to some normality during the course of next week. We're here, Jerry, to try unpack and demystify what happened last week. So the state of disaster ended on midnight on Monday, and effectively straight as that happened, as soon as that happened, a code of good practice regulation under the Labour Relations Act issued by the Minister of Department of Employment and Labour came into effect. And of course, that diagram there on the slide, and these slides will be available to you. Just Natalie, if you can email them to everyone, it'll be fantastic. That's really the state of where we're at. That the Biological Hazardous Act is being updated and amended. We just published on the 16th of March. People have got the opportunity to the 16th of April to comment, and then they'll come law, and we'll show you what you'll have to look for. But if you implement the code of good practice in managing exposure to COVID in the right-hand side, the block, the green block, which came into effect in 12 on Tuesday morning, then most of the hazardous biological agents regulations will be implemented in your company, and we'll show you the difference there. So there's a lot of work for companies to do in regard to the law and in respect to where the law is now. And we're just going to look at that. We'll also touch the national health amendments, but they're mainly for public. Of course, the state of disaster continues in essence, parts of it, and we'll show you that too, till I think the 5th of next month, the 5th of May. And then what will happen, in our opinion, is the Department of Health and the Department of Employment and Labour will issue through codes of good practice, like mask wearing, like any restrictions on venues. Of course, us as business are trying to fight against any restriction of venues. But of course, we have, for instance, last night, the infection level going up again to 7.5. If that continues to rise like we're expecting it in May, then of course, a whole lot of things will change. But you don't need the State of Disaster Management Act to actually implement what needs to happen in respect of managing COVID. COVID is a hazardous biological agent, so there are regulations that we have to implement in any case there, and we'll touch that during the course of this morning's lecture. Please use the chat box, and we'll answer any questions we can. I'll try and monitor the chat box. John, in the chat box already is good morning from Natalie. Over to you, John. Thank you.
Morning, Johnny, Natalie, and all the colleagues. It's really good to be with you on a day before a long weekend. This morning early, my first meeting with a client on COVID-19. They were pursuing mandatory vaccinations, and she asked me what my sense was of what's happening out in the marketplace around COVID-19. And effectively, colleagues, many companies were adopting a wait-and-see approach. And now that we have the clarity that Johnny is speaking of on the screen, so 2.0 is giving us absolute clarity on the way forward. And what we are seeing is organizations are embracing that clarity, and many of them are saying, well, listen, even as recently as this morning, the World Health Organization said that COVID-19 is not going to be downplayed, it's yet to be dealt with, and certainly that vaccinations are front and center. So my personal view, colleagues, is we've got certainty. Let's get down to business. Let's make sure our organizations are sustainable. And that's really what we've put on the slide. You need to design an integrated workforce plan that covers all these requirements. One of the challenges was we got different pieces of legislation. You know, we've got the HBA regulations, we've got the code of practice, and now we are soon to have the National Health Act regulations. And the question that needs to be asked is, to what extent do they align with each other? How easy it is to ensure that we integrate all of that? So the green today, ladies and gentlemen, is the 2.0. Though the green are the statutes that we need to ensure we align with. As Johnny mentioned, we are waiting for the regulations to the National Health Act. What we can tell you, and we've seen these regulations in draft form, obviously they've been published for comment, but the good news today, on this Thursday, is that these regulations are absolutely aligned to the code of practice and to the hazardous biological agents regulation. So if you do what we're going to tell you now, the good news is this National Health Act amendment will not require more work from you. So that's really important. And then just to, again, underpin what the World Health Organization have said, you know, you look at Germany, a similar population size to South Africa, you know, still 74,000 new infections a day, 187 deaths. You know, we take a look at Hong Kong recently, the Omicron variant really trending and being a big challenge in respect of this. And then even local, you know, Department of Health, SA coronavirus website, colleagues, you've got to go on there at least once or twice a week. Slide 16 on their presentation every day, which is updated through Microsoft BI, you can see the number of people admitted to hospitals in terms of wards, intensive care, and high care. And you can see the little red icons, people who are unvaccinated, and the green icons, those who are vaccinated. So it's not a silver bullet. But what we can tell you is, as long as we can see going forward, vaccinations are going to remain the primary mitigator of risk, lives and livelihoods. The problem, of course, colleagues, and this is why government have now legislated it finally, despite a lot of pushback, is we've got less than 50% of our population that's vaccinated. They've got high natural immunity rates, but that natural immunity is going to wane. So that is why we've got these regulations. Now, if we look at it from a labor law point of view, there are three clusters. The Occupational Health and Safety cluster. So the OSH Act, ladies and gentlemen, where the cursor is now, the OSH Act has always been there since 1993. It remains there. And under the auspices of that, the hazardous biological agents regulations are published. Then we've got the LRA. Under the LRA, the Code of Practice on Managing COVID-19 at the Workplace is published. Then we go to the other, the Employment Equity Act. This morning, client says to me, we haven't done the full risk assessment, but we're already requiring job applicants, Johnny, to be vaccinated. Is it fair or unfair discrimination? So the Employment Equity Act kicks in UIF in terms of sick leave. If you exhaust sick leave, you claim top-up UIF, occupationally acquired COVID through COIDA, and then, of course, the Constitution. Now, colleagues, a lot of you on this call are obviously in temporary employment service environments. So let's understand what's going on here. The first one, the client is defined as the employer under the OSH Act. So your temporary assignees that are on site with the client, they've got to fit in with the client's policies, procedures, workplace plans, and risk assessments, because the client is the employer. However, when it comes to things like the LRA around equal treatment, when it comes to the Employment Equity Act, UIF, COIDA, the TS is very much involved, because the TS is the employer for UIF, the TS is the employer for COIDA, and of course you've got joint liability with the client under the Employment Equity Act. So the fact that the client's the OSH Act employer, remember, for the rest, colleagues, that's not the case, and you've got to be involved and you've got to administer this and give value add to your clients. Now, we are reminded in the code, Johnny, that imprisonment and fines are the order of the day if organizations don't comply.
And we don't want anyone to go to prison specifically over the long weekend, so we want to keep you out of prison. And I see one of my comments in my LinkedIn was, you know, these regulations are another money-making machine. The point is, whether you like it or not, they're part of the law, and we've got to comply. And our job as global and CAPES is to ensure that you comply without spending too much money, and to ensure that you comply to actually keep your people safe and to get productivity up. So we just want to keep you out of the non-compliant issue. And it's amazing, the Department of Labour in respect of inspections just come from nowhere. I mean, we got inspection on our East London office for next week. But it's so nice because effectively it takes 1 minute to say, okay, we've got everything in order, because that's exactly what you want to do. And the requirements in inspection from the Department of Employment and Labour is not too difficult. So here, John's done a great comparison of the comparator of the old consolidated direction, which is now gone in terms of the Disaster Management Act, and the new one. And I think the important thing for me is if you've got more than 20 employees, you have to do this risk assessment. You have to have a written appointment of a compliance officer. If you've got less than 20 employees, we'll show you in a graph just now that you have to do less than this, but effectively more than 20 employees, which is all of you here on this call, you have to do some of these issues. And again, we know it's compliance, but I think if you look at compliance from one, trying to make people safe, trying to keep them healthy. You know, I have my son's partner now who's got COVID this week, and she's a week out of work in Australia. Here in South Africa, it's 7 days out of work. So, you know, that's the real big problem about contracting it anyway. And of course, at the workplace, we just got to try reduce that risk. You are entitled, according to the new regulation, clearly to disclose the vaccination status. So I can say, John, are you vaccinated or not? You need to produce a vaccination statement. No debate about poppy and all that kind of rubbish, done and dusted in this. Of course, it may include when you do this risk assessment in the plan, it might include the minimization of the number of workers at the workplace. You have to consult with the Occupational Health and Safety Committee and, of course, any sufficiently representative trade union. There's no reporting to authorities anymore, so that's one of the issues that is easy to now tick off as a non-reporting issue, so you don't have to report anymore. And of course, if they are diagnosed without any symptoms, it's amazing they've left out even wearing a surgical mask. Now, some of the questions, John, you can deal with that question straight after I'm finished here, but some of the questions that will come up is like one of our lawyers had COVID last week, no symptoms, but we asked him to stay away and work virtually. So we are still implementing, even if you have no symptoms and you test positive because you're going to a funeral, that's why I tested, then effectively you still stay away from work. And if you do come to work, for my mind, although it's not in the regulations, you should wear a surgical mask. Close contacts no longer applicable in terms of legislation. So that's a nice new advance that you don't have to isolate and get people out the workplace because that's just crazy. And effectively, there's a whole issue around medical certificates. So if you have got a medical certificate, John, that you can't have the vaccine, then we can send you for a second opinion. And effectively, what we then would do is we need to look at all reasonable alternatives. Craig Kirschman's on the view. I wasn't at first the way the legislation's drafted that you couldn't dismiss John, but we are of the view that you can dismiss John after having gone through all the hoops. So, John, back to you. Thank you. You've answered the question in the chat box. You're so efficient. Well done. Ciao.
Yeah, thank you, Johnny. And it looks like the Johns are active, not the Natalies and the Javis, but it's Johnny Goldberg, it's John Botha, and now we see that it's John Marshall. Well done, John. We very, very high adult. We action-orientated guys. But as Johnny's indicated, colleagues, one of the issues, though, in the comparison is the definition of vaccinated. And it's in these nuances between the old and the new that you've got to be so aware. Now, even though a TES is not the employer for health and safety, your client could very well come to you and should be coming to you and saying, well, how many of your staff are vaccinated? How many of your assignees? You know, some TESs on this call probably place north of 5, 10, 15,000 temporary workers a day. You know, your clients should be coming to you and saying what percentage is vaccinated and not. Now, what does vaccinated mean? And you can see, colleagues, the Code of Practice has extended that to include additional doses or boosters, and vaccination has the same meaning. So what now happens is the original requirements. So if you look at the table on the right, if you went for Johnson & Johnson, fully vaccinated meant you just got one shot of J&J. Now they're saying, no, the new definition is including boosters. So now it's J&J plus 60 days later, another J&J or Pfizer, plus 90 days later, another J&J or Pfizer. So colleagues, you now have to redefine the definition of vaccination, and you're going to have to give your colleagues, your staff, another 150 days at the least to catch up to the boosters, which means full vaccination. You know, if you went the Pfizer route, the bottom one, 2 shots of Pfizer with a 21-day interval, and then 90 days for your boosters. So at the bottom right, when you do classify your employees in terms of their vaccination status, there are at least 8 variants. You know, they could be Pfizer ×1 or Pfizer ×2 plus a booster. So, you know, it really means you're going to have to update your vaccination policies, your definitions, and the time periods in which you roll this out. Now, the previous, this particular slide here was for non-immunocompromised people. If you have employees that are immunocompromised, as recently as, I think it was this week, Johnny, you sent me this, if you are immunocompromised, there's a different time frame. So I'm not going to go through it and bore you, but you know, you've got to see that people that are immunocompromised, instead of a 60-day and a 90-day interval, they got shorter intervals. So as Johnny said, colleagues, you can't not have data on people's comorbidities. You can't not have data on people's vaccination status, because without that data, you will not be able to implement these definitions if you are pursuing, you know, a proper risk assessment and mandatory vaccinations. Now, talking about that, and then maybe, you know, when we look at the procedural fairness slide next, Johnny and Nats, we can unpack it in more detail. But I did have a sense under the 1.0, the consolidated direction, that employers sort of thought, well, I've got discretion, you know, as to whether or not do a risk assessment. I've got the discretion. If I don't feel like it and the 21 days have passed, what the hell, you know, I'll just leave it. But if you were in doubt, well, your doubt should now be eliminated, because the word must means must. It means every employer must undertake a risk assessment. So you don't have to think really hard about that. And as Johnny indicated, you know, that includes employers in general. The next thing is, well, what must be in that risk assessment? Well, we're going to get to that, but the outcome of that means you've got to develop a plan. Look at this word here, develop or amend your workplace plan. You say, well, what must be in that plan? Well, there are 2 things that have to be in. And look how they subtly, in one way, but very consciously in another way, they say your workplace plan has to address 2 things. And the one is vaccination. They say you've got to state what measures you're implementing around vaccination and taking into account the intervals between vaccinations. And that's why we've shown you these immunocompromised and non-immunocompromised timeframes, colleagues, because, you know, your plan has to have a statement on vaccinations. Even if it is, we're not going to go mandatory, but then you better be sure that your risk assessment doesn't require that. The second thing is, once you made a decision on vaccinations, any other protective measures, so sanitization, screening, medical surveillance, ventilation, you know, social distancing, wearing of masks, any other measures. So your workplace plan is now very, very clearly, you know, set out. So Johnny, I mean, this is really what you're saying in the 2.0. This is what employers need to do. In labor law, we know procedural and substantive fairness is what it's all about. So can you make it mandatory for your temporary assignees to be vaccinated before you register them on your database? Can you make it mandatory? Well, the answer is simple. The answer is yes, on condition you've done these 6 things. If you haven't done these 6 things to get to mandatory vaccinations, well, then it will be unfair discrimination because you haven't followed the procedure. So what do you do? Step 1, conduct to update your risk assessment. Together a workplace plan. Consult on the plan with a representative trade union. Yes, Samantha, you will be with a representative trade union or the OSH committee. Implement the plan, manage absenteeism, and then accommodate employees who refuse to be vaccinated. And if you can't reasonably accommodate them, there's a little one we've left out, which is incapacity hearings and potential dismissal. So colleagues, this is the procedural fairness flow diagram. And then the other side of the coin is substantive fairness. In other words, the code says, okay, so that's the process you need to follow. What is the content? Well, in your workplace plan, you've got to have a section talking about notification, in other words, advocacy and awareness campaigns. You've got to look at ventilation. You've got to look at symptom reporting. You know, colleagues, even though you don't have to stay away from work if you're positive but asymptomatic, most of our clients are saying, if you're positive, we don't want you at work in any case, because you might very well end up sitting next to someone with a comorbidity and infect them. So, you know, you still have to apply better than the minimum if the risk assessment dictates that. Isolation of workers. Very important, colleagues. You've got to, in your workplace plan, you make it a disciplinary offense. If John arrives at work symptomatic and he does not report that, then it's a serious disciplinary offense. Because some companies are stopping screening at the front desk. You see, some companies are saying, must we still at the front desk say if you're sneezing or coughing, Johnny, or if you've got a fever? They're saying, can't we rather replace that with a clear policy that if you are symptomatic, you've got to not come to work, or if you're already at work, you've got to tell someone and leave?
And my view is, of course, you can do that. Exactly. The question is, will mandatory mask wearing be part of the plan? Depends on your risk assessment as to whether you can keep people apart or not. And while this virus is still around and we're going to the 5th or 6th wave, or whatever wave, the wearing of masks is one of the simple measures that, to my mind, should always be in place in a, say, call it a factory environment, as an example. John, just on that point, I wanted to, the issue around rules and regulations. One thing that I did disciplinary inquiry training for 2 days of this week. I haven't done that for many years, but I must tell you, our disciplinary inquiry training video is still very, very, very relevant. We did it in 2014. But the one thing is clear to me: we've lost complete discipline at the workplace in most workplaces. Forget about poor performance measurement and ill health measurement, just on the basics of misconduct. And we need to bring those measures back, including these measures around these new rules that we're putting after our risk assessment. Thanks, John.
Thank you, Johnny. So it's not only around COVID, Johnny, these rules, it's about cyber crimes, it's around POPI. We need to update, we need to remain relevant, but that's not the topic for today. So if you're a temporary employment service, you better make sure that your policies, your procedures address these issues. Now, we've touched on the issue of vaccination. So if your risk assessment indicates a vaccination policy because of the risks at the workplace, the code of practice has taken away any uncertainties. They've literally given you a paint by numbers. Step 1, tell the employees about your risk assessment that they need to be vaccinated. Step 2, counsel them. Step 3, let them speak to OSH reps in the union. Step 4, register them on the EVDS and give them paid time off and transport. But if they refuse, ladies and gentlemen, counsel them, try to reasonably accommodate them. And then, as Johnny said, if they still cannot be reasonably accommodated, they refuse the vaccine, incapacity is the way to go, incapacity hearings. Now, it's quite incredible how some people suddenly change their mind when they get a notice to attend an incapacity hearing. Other people with very legitimate medical and other concerns, obviously, that's a whole different ballgame, and we need to really try and accommodate them. Just on the issue of objections, the consolidated direction, as you know, specified 3 grounds for objection: medical, bodily integrity, and then religion and culture. So in the new environment, colleagues, it seems different, because when Johnny went through the 1.0 and 2.0s, right at the bottom here, in 1.0, it said 3 grounds on which you can object. New wording says if an employee refuses to be vaccinated. So it almost opens it up. It says you can refuse on any ground. And then they say, but if it's medical, well, yeah, they go and do a more detailed investigation. But colleagues, the bottom line is the following: whatever the ground for refusal is, you have to do 2 things. The first thing, you've got to have a one-on-one and determine the validity of that objection. And secondly, once you've determined validity, you go to reasonable accommodation. You see, this is this part of the process over here. You need to seek to accommodate them. If after the validity and accommodation has been addressed and you can't assist them, then unfortunately, as we see the CCMA, etc., they say permanent incapacity is the way to go. Now, just further to the question around wearing a mask. So as Johnny said, there's a 30-day transition period. So from the 5th of April till the 4th of May, you have to wear masks. The limitations on gatherings is still there. And of course, entry into South Africa's borders is still there. But after that, colleagues, after that 30-day transition period, the question is the following. The question is, will we have to wear masks? And Johnny's answer is correct. Two things. Firstly, we're going to have to wait for the Minister of Health's final amendments to the National Health Act communicable diseases regulations. And I've got a very strong sense that they will continue to apply wearing of masks for indoor public spaces. I really believe that's going to continue. But let's wait and see what happens. And the second one is, of course, your risk assessment. You know, I walked around a call center this morning. I did a workplace risk assessment for this client of mine. I can tell you now, they are at high risk. They got call center agents sitting like budgies on perches, sharing, you know, very close space, sharing common areas, and quite frankly, it's a challenge. So Samantha says, incapacity hearing, is this for employees who are healthy? Samantha, absolutely. And that's a bit of a paradox, isn't it? Because you've got a perfectly healthy employee refusing to be vaccinated, yet they're being called into an incapacity hearing. It doesn't always seem to line up. But if you look at misconduct, incapacity, and operational requirements, the CCMA is embracing what they call permanent incapacity. And of course, that was confirmed in the Gold Rush case. So if you don't have that, Samantha, please drop us a mail and we'll send that case to you. So ladies and gentlemen, please remember, employees have to comply with your workplace plan. So once you've done your risk assessment and you've put your plan together, they've got to comply. The only time employees need not comply, if they can prove there's an imminent and serious risk. In other words, you as an employer have dropped the standards, you're not applying them. And once they believe there's a risk, they've got to notify you, allow you to discuss it with your OSH committee. And only then, if you haven't resolved it, then notify an inspector within 24 hours. The other thing we want to just confirm, PCR testing is not for the account of the employer. So if someone refuses a vaccination and as an alternative to dismissal, or as an alternative, you allow them to do PCR testing every 72 hours, you are not, as the employer, obliged to pay for that and fund it. The reason being twofold. The first thing, colleagues, is PCR testing is not PPE. PCR testing is not PPE. You see, this clause here, no deduction from remuneration, that is in terms of protected personal equipment. When it comes to other means of mitigation, employers have suffered undue harm already. So employees would have to fund those alternatives themselves. And it's expensive. It's between 3,000 and 6,000 Rand a month, depending on your shift patterns, depending on your client calling patterns. Now you might say, but what if we're less than 20 employees? How does this affect us? Well, as Johnny said, you've got a lesser burden of compliance. You still got to do the risk assessment, but you don't need to draft a detailed plan. You don't need to consult on it, but you do have to implement that plan and, of course, manage that accordingly. So good news, sort of, if you employ less than 20 people. So let's change gear. That was the code of practice under the LRA. Now let's see, using that as the center, let's see if the hazardous biological agents regulations require anything more. Well, the good news is they reiterate the need for a risk assessment. So we've been there and we've done that. What else do they specify? Saying, in addition to what we've told you, you've got to induct people. When you recruit people, you've got to make them aware. If you look at subsection 3, you've got to inform them of risks. So when you do harassment awareness training during induction, include COVID-19. You need to do at least an annual refresher, toolbox talks, communications, videos, whatever blows your hair back, whatever that is. You also have to make third parties aware of the risk. So when people come onto your premises, keep your posters, keep your marketing collateral up so that people are aware of it. Next thing is they say the risk assessment should be done by a competent person. Now, the good news is you don't need a degree to be a competent person. They say it's a person who is deeply understanding of your business, the workplace, and the dynamics. But make sure it's done by someone that's got the aptitude and the insight. And then, of course, your risk assessment has to be done every 24 months. So, ladies and gentlemen, we talk so much about the risk assessment because that is truly the point of departure. You might say, but is there a template? Is there a framework from government? And the short answer is there's a framework, but no template. Government have given you the bottom right-hand side, and they're saying, well, once you've done a risk assessment, the results are either low, medium, high, or very high. But they don't give you the stage before that. So when I walk around your workplace, what do I look for? What they do give you, though, is these 7 factors over here. So they say, even though we're not giving you a template, you've got to look at the possible routes of exposure, where COVID could be present, the nature of work, the current control measures, the impact that it can have if people are infected. What recommendations are there in terms of the hierarchy of controls? And then ultimately, how are you going to improve on that? So, ladies and gentlemen, we touched on this earlier, but at the end of the day, your risk assessment has to look at 2 things: the human and the workplace. So your risk assessment's got to say to you, in Global Business Solutions, we've got a 95% vaccination rate. We've got a 40% comorbidity prevalence. That's the individual risk in global. Then we look at the workplace and we say, what is the risk in terms of ventilation, proximity, sharing of equipment, client engagement, transport? We then bring them together, and then you get sort of a heat map at the bottom here. The heat map tells you whether the workplace is low, medium, or high. The horizontal indicator is the people risk. So you got high people and high workplace risk, 7.2%, moderate people risk, and medium workplace risk. So this, colleagues, is necessary because off the back of this assessment, you then decide, do you go mandatory or not? Very, 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 very important. Then maybe the last comment before we can open up for general discussion and questions and whatever. But once you've done your risk assessment, you've got to put a workplace plan together. Now, the workplace plan, we highly recommend, covers these issues or these areas, because if you cover these areas on the screen, I can guarantee you that you will have covered all the legislation in one document. And you won't have a sleepless night about being locked up in jail, as Johnny said, with old Tiny, spending a few nights with Tiny in the cell. You don't want to be with Tiny in a jail cell for any period of time, and that's especially not 12 months. Certainly, colleagues, you need to cover these areas, and more importantly, your annexures. So in your workplace plan, have your supporting documents, attach your risk assessment. Your appointment of your COVID-19 officer, it has to be a written appointment. Attach that. Attach your screening questionnaires and templates. Attach your employee disclosure forms around vaccinations and comorbidities. Attach your vaccination policy, your remote work policy, your objection template, your worker awareness collateral, all the mailers. A client, of course, asked us 2 days ago. They said, John, we want to do a 5-week newsletter focusing just on COVID-19 to our manufacturing environment workforce. Please put 5 weeks of communications together where we explain why is it that government are legislating? How should we respond to it? frequently asked questions. Colleagues, this is what it is all about. If you cover these areas, we can guarantee you that you will be absolutely on track in terms of compliance. So we're not going to go through this. This is the National Health Act, which, as Johnny said, has been submitted or published for 30 days of public commentary. I think it's really, just to prove to you that you don't need to worry about this act and the outcome, that we've covered it already. I mean, you can see here, when gathering in an indoor public place, wear a face mask. So the colleague who asked about the face mask, I think it was John or someone. So, so many Johns, probably 80% chance it was John. Okay. But, guess what? The National Health Act regulations are saying already, when you're in indoor public place, wear a mask. When you're using public transport, use a mask. Employers must provide employees with a mask. So you don't have to be really bright to see that unless there's huge litigation that is lost somewhere along the line, that even after the 5th of May next year, next month, there will be masks. And then you can see here, public places, government departments, municipalities, and private entities. That's you. Responsible for public places, you're responsible for public places. You've got reception areas, you've got visitors that come on your premises, you've got your own employees there. What must you do? Look at that. You must assign in writing a COVID-19 officer. Then they regulate funerals. Then they talk about gatherings, maintain a distance of 1 meter, display certificates of occupancy. And Johnny, what's really interesting for me is this one. If you have gatherings like at sports stadiums, they're still going to want you to have access control, proof of vaccination, or PCR tests with the limitations of 50% of the capacity of that. But colleagues, the bottom line is, even though we're going to go past the 5th of May, I think certain core things will remain unchanged. So do you need to probably carry on wearing masks indoors? Yes. Should you continue screening your staff? Yes. Do you need to continue sanitizing? Yes. Should people that are symptomatic not come to work? Yes. Do you need a COVID-19 compliance officer writing? Yes. Do you need to have a risk assessment? Yes. Do you need a workplace plan? Yes. You see, colleagues, that is the certainty that we have going forward. So in light of that, Johnny, really just opening up you and the colleagues for discussion.
Thanks, John. Brilliant. Nice, clear, simple exposition. We'll send these slides out. Just we have a system called the VOC, which you're happy to inquire about, that really manages us for your large clients. And we truly believe that the implementation of that system would just help and have a multiple return in terms of value. The one thing that's shocking is the comorbidities that we've now established in the workplace because of COVID. And we need to start managing that. Otherwise, it just comes back in absenteeism and productivity issues. The question on the chat group is around incapacity. The cases up to now have said that if you cannot come to work with a negative PCR test or you refuse to be vaccinated, we could dismiss you for incapacity. That's the big case. Again, the simplest way, of course, is to not get too contentious, is you implement a access policy to say, listen here, John, you don't want to be vaccinated for whatever reason. That's cool, that's fine, but you bring a negative PCR test every 72 hours at your own cost. The cases say that's cool. The labor court case says that's cool. And all the headings now are under capacity dismissal. So in the Sassel case, where the person was dismissed because they refused to bring a negative PCR test at their own cost, and they implemented properly this vaccination policy, they were dismissed for incapacity, and the CCMA said that's fine, no problem. Of course, incapacity would be under ill health. John, in the example I used, can't get vaccinated hypothetically because of ill health. We would then go down the ill health route with John if there aren't any alternatives that he could do. He couldn't work remotely, as an example, because in this case, John can't be vaccinated, he wants to, but because of hypothetically his comorbidities or something that's wrong with him. There's nothing wrong with him, by the way. He's pretty fit. I do beat him running nowadays, but I mean, he promises to try and catch up on the Easter weekend. So that's a lot, ladies and gentlemen. Hopefully that helped you for the Easter weekend. Helped you just, and we are available, John, myself, and Natalie. And yeah, John, maybe the closing word to you. Thanks very much for your time today. We know your time is valuable, but we really do appreciate it. We're always trying to give value to the clients of the TES industry, and of course, to the TES industry themselves. And specifically, very much, we want to always help their clients implement simple solutions to complicated legislation. Your last word, Jono, over to you.
Johnny, yes, I need to catch you in terms of running, which I shall work on. And just to thank you, Johnny and Natalie, for giving me the opportunity to speak to the colleagues. You know, this industry is close to my heart. And you've got so much opportunity to differentiate yourself by adding value to your clients. So, ladies and gentlemen, you know, really just to say, stay in touch. We'll keep you appraised of the National Health Act, the outcome of those engagements. We do see a lot of stakeholders like the DA, Solidarity, and even the ACDP, the Christian political parties, Nats, they're pushing back. They're saying this is a smokescreen for government to continue undermining democratic rights. So there's a lot of water to flow under the bridge. But even, as I said, at the World Health Organization, if they say COVID is still the big ticket item, we've got to manage it carefully, well then I think the interests of the majority will always trump the interests of the minority. Thanks, that's all from me, and over to you, Nat.
Thank you. Thanks, gents, for your time. I just thought, given that we are a largely TES audience, I just wanted to just give some feedback in regards to the UIF and the e-compliance. There is a memo that we're busy preparing. There was a mail that went out. You will have noticed, if you've gone onto the e-compliance system, that they have suspended issuing the compliance certificates after we've pushed back. And there is that circular which is now to be utilized. We had a productive meeting with the UIF and other key stakeholders, including the Payroll Authors Association and SAICA on Tuesday. So we hope that we'll get some track in terms of their revision of the way in which they are measuring declarations and compliance. Of course, please ensure that you continue to comply and do your declarations monthly, make your contributions so that everything is kept neat on your side. But hopefully that will help to resolve some of the tensions that has happened. So please do look out in your inbox for the memo, the circular, and everything else which will be shortly coming. Thank you.
Thanks, Nats, for your great work in respect of helping us with the UIF. And I know you've got grayer, but thank goodness for dye. I've got balder, but no, thank goodness for implants. But just wishing you all a happy Easter, happy Passover, and well over the fast Ramadan for all of our particular colleagues. And just rest well over the Easter weekend. And our hearts and thoughts go out to all of you in KwaZulu-Natal. Thank you. Bye-bye.